This video will be a lot different than my normal videos. I'm talking about Plandemic, a quote-unquote documentary regarding coronavirus that's been taken down from YouTube, but widely shared on other platforms. I'll provide some factual background, I'll analyze some specific claims made in the video, and I'll wrap up with some closing analysis. Note that this video is not legal advice and does not represent the views of any organization or clients that I may work with. First, the factual background. The video is an appeal to authority, specifically the authority of Judy Mikovitz. Judy is a former researcher who manipulated a scientific study that claimed to find that she had discovered a viral basis for chronic fatigue syndrome. CFS is serious and mysterious, so if she had, in fact, found a virus that caused chronic fatigue syndrome, it would have been groundbreaking. Her alleged findings were published in a major journal, but when they couldn't be replicated, the journal discovered that Judy had manipulated her data and retracted the article. Now, when it comes to the end of Judy's career and her arrest, she directly lies to the filmmaker.
And so what did they charge you with?
Nothing.
But you were in jail.
I was held in jail with no charges. I was called a fugitive from justice.
She knows exactly why she was arrested. She worked for a research company, and her employer accused her of theft. She was charged with theft. Ultimately, the charges were dismissed, as there were problems with the prosecution. One of the lab owners had contributed to the campaign of a prosecutor, so it created a problem with proving the theft charges using unbiased witnesses. All of this, her theft charges and arrest, were occurring as her manipulated study results were exposed. So, despite her claim, she was never held in jail for days with no charges, nor could she have been. The next issue to talk about is what happens for government funding for research. The US government spends billions of dollars funding research efforts, and for decades, what happened to the results of the research was a patchwork mess of who could use the discoveries that were funded, in part or in whole, by the US government. The government did not do a good job of bringing discoveries to market, so the Bayh-Dole Act provided some consistency for government processes. It allowed organizations, like universities, to patent discoveries and to bring new drugs and treatments to market. But the government did protect itself and the interests of taxpayers. For government-funded research, the government demands notice of any new discoveries. It retains the right to use the discoveries, and the government can give the discovery to someone else if the investigator or institution sits on the discovery and does not bring it to market. As to government employees, here's what Judy claims about the Bayh-Dole Act.
That act gave government workers the right to patent their discoveries. So to claim intellectual property for discoveries that the taxpayer paid for, as they already have with their vaccines.
This isn't quite right. When they are working for the government employees are not allowed to personally own the patents for their discoveries. So Anthony Fauci, for example, does not personally profit from any discoveries that he made while working for the US government. In fact, from what I can tell, all patents listing Fauci as an inventor have been assigned to the United States. Now, let's get to some of the specific claims made in the video. There are two categories that I'll talk about. Some of the claims made are flat out false, while others are significantly misleading. First, the flat out false claims.
There is no vaccine currently on the schedule for any RNA virus that works.
This is absolute garbage and extremely dangerous. Measles, for example, is an RNA virus. It has a vaccine, and the vaccine works. This concept, telling people to resist things like the measles vaccine, kills people. Next is this.
In 1999, I was working in Fort Detrick in USAMRIID there, and my job was to teach Ebola how to infect human cells without killing them. Ebola couldn't infect human cells until we took it in the laboratories and taught them.
Wait, what? She's claiming that Ebola didn't kill anyone, that it didn't know how to infect human cells prior to her teaching it to do so in a lab? This is insane. But what about her comments on autism?
But back in autism, with our discovery, there was an old antiviral drug, 100-year-old drug called Suramin, on the WHO list of essential medicine. It literally gave kids with autism a voice, a life. What did Bayer and Monsanto do? They took it away from everybody. You couldn't get it to save your life right now, and we tried. Believe me, every way we could. So when you take away a medicine, and not just the WHO, not just the WHO, the FDA, the CDC, Tony Fauci, close everything. Just end it all, and we've got a healthy world again.
In this clip, she specifically mentions Saramin. She said it, quotes, cures autism, but it's being suppressed by drug companies and is not being studied. This is absolutely false in a couple of ways. First, Saramin had a transitory or temporary effect on autism symptoms, but was nowhere near a lasting cure. Second, Saramin and drugs like it are actively being studied in major research institutions, not just for the specifics of any one drug, but for the mechanism of action, to help understand why some treatments appear to work, even temporarily, and others do not. Next is this one about masks.
Wearing the mask literally activates your own virus. You're getting sick from your own reactivated coronavirus expressions. And if it happens to be SARS-CoV-2, then you've got a big problem.
This is complete nonsense. There is nothing about wearing a mask reactivating anything. There is no science on this at all. It's literally a crazy rant. But maybe it's not the craziest one.
Why would you close the beach? You've got sequences in the soil, in the sand. You've got healing microbes in the ocean, in the salt water. That's insanity.
Seriously? She thinks going to the beach stops infectious diseases? This is straight dangerous. It's a fantasy belief and is the same premise used by those that deny the use of modern medicine for the treatment of serious conditions. I think the ocean is great. I went to Pepperdine University in Malibu, and I've spent some time at the beach. But the beach is not the answer to addressing infectious diseases. Moving on, some of the other assertions in the film are incredibly misleading based upon information that is only partially true. Take this one, for example.
I've talked with doctors who have admitted that they are being incentivized to list patients that are sick or have died with COVID-19.
Yeah, $13,000 for Medicare, if you call it COVID-19.
Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much.
So this is false. There is no flat reimbursement per COVID patients. Hospitals are reimbursed based upon the actual treatments provided to a specific patient. This exists not only for this outbreak, but for all government funding in hospitals. The formula is complicated and takes into account geography, costs, hospital size, and other factors. Now, during this pandemic, hospitals are provided with a 20% across-the-board increase in reimbursements for treating COVID patients because the enhanced funding came as part of a broader coronavirus bill. Next is this one.
If my husband were to die, who has COPD, his lungs have fibrosis, his lungs would look exactly like somebody with COVID-19 theoretically, but he has no evidence of infection. So if you're not testing and you don't have evidence of infection, and if you walked in there today, they'd call it COVID-19. And we hear this from the doctors and nurses who are upset.
Again, half true. We all know that there was a shortage of tests for a period of time during the pandemic. So some people were diagnosed based upon clinical symptoms when tests were not available or otherwise not performed. But now, hospitals across the United States have COVID tests, and current patients are diagnosed based upon the presence of the virus, not by clinical symptoms alone. Or how about this one?
Italy has a very old population. They're very sick with inflammatory disorders. They got, at the beginning of 2019, an untested new form of influenza vaccine that had 4 different strains of influenza, including the highly pathogenic H1N1. That vaccine was grown in a cell line, a dog cell line. Dogs have lots of coronaviruses, and that's why they're not testing there. You could just say, oh, it was that.
Here, she's absolutely right on some accounts. Italy does have an older population, and I'll add that they have a relatively high smoking rate as well. But her claim about the flu vaccine somehow causing these deaths is based on nothing more than her wild claims, especially since she seems to imply that it has something to do with H1N1 being included in the vaccine, even though there is zero evidence that H1N1 vaccines cause coronavirus. And as an aside, there is no coronavirus in the flu vaccine. She also cites this to back up her claim.
The flu vaccines increase the odds by 36% of getting COVID-19.
Where does that data come from?
A publication last year where the military who had been vaccinated with influenza were more susceptible to coronaviruses.
This study actually showed that flu vaccines were safe and effective in reducing the risk for both flu and respiratory illnesses overall. In this single study, 2 specific subcategories showed an increase in risk, which included the subcategory of coronaviruses. The study itself was extremely pro-flu vaccine and noted the apparent risk for coronavirus exposure was not repeated in other studies. In other words, Judy cherry-picked one part of one study that was absolutely pro-vaccine and used it as part of her anti-vaccine propaganda. Judy also takes another statement completely out of context here.
The AMA was saying, doctors will lose their license if they use hydroxychloroquine, the anti-malarial drug.
What the AMA actually said was that doctors prescribing it for themselves or their families, in other words, not for patients, was unacceptable. This position of the AMA is consistent with prior medical practices, that doctors should not write prescriptions for themselves or their families. And here's the real quote from the AMA regarding these drugs. Quote, "Novel off-use of FDA-approved medications is a matter for the physicians or other prescribers' professional judgment," end quote. In other words, the AMA discouraged doctors from treating themselves or their own families outside of the normal medical process when they showed no symptoms, but supported doctors' efforts to try, quote, "novel off-label use," end quote, when it was appropriate in their professional judgment. Finally, there's this doozy.
Scientific journals would twist the discovery that should have healed all.
So she's claiming that she has a cure for all, but no scientific journal would publish it. This is quite literally an insane proposition. Even if it were somehow true, research institutions or private institutions, someone would know about this unspecified miracle cure for everything, but he only exists in Judy's mind. All that said, here are my final thoughts. I believe in free expression. I believe in the exchange of ideas. And on this issue, I personally believe that we should consider having the elderly and the vulnerable shelter in place while the young and healthy, the low risk, build herd immunity and support a strong economy. But not all ideas are equal. Not all perspectives have equal merit. If you're going to speak to the public at large, you have an obligation to tell the truth, to report accurate information. Judy's video is dangerous because it has provably false information mixed in with half-truths. It took hours to review the video, research its claims, and to find out if they had merit. I spent the time to do this, but I'm afraid most viewers of Plandemic won't, and therefore, many people may form opinions and take actions based upon bad information. The bottom line is, there are reasonable bases to disagree on the responses to COVID-19. There are important decisions to be made about individual freedom, but the debate is not well served by people like Judy and her supporters deliberately misrepresenting themselves and data to serve their agenda. If you have more to say on this issue, feel free to leave a comment below. And don't forget to like this video and subscribe for more videos. Videos are published every Sunday at 5:30 p.m. Arizona time. Thanks for watching. I'm Steve Serbalik. Stay safe out there.